Plane that brought the Ebola patients to America?
The ambulance that transported. We spoke to the pilot of the plane, though, and he said that it was an honor to transport the patients, and that in the case of Nancy Wright-Bowl and Kent Brantley, they were kept in an isolation kind of containment unit the entire time, effectively a bubble on a bed, and they were. He said that he saw Nancy Wright-Bowl walk onto the plane in Liberia. Of course, we saw her taken in on a stretcher once she arrived into the hospital. Her condition said to be improving, and she's visiting with her two sons, and her husband's on his way.
Let's talk about, because there's a lot of misinformation, a lot of people don't know a lot about this. For somebody to become contagious or to get the virus, there needs to be some type of bodily fluid. So even though you were there, your risk of getting Ebola was virtually nothing, right?
That's correct. And the best way to prevent the spread of Ebola is to contain patients who have it. And that's why we've seen these isolation units where they are in the hospital, the containment pod in the plane. The ambulance I was in had been scrubbed clean but lined with protective covers to contain any body fluids, and then all those sheets and liners that they use are burned to prevent the spread. And it's that kind of sanitation that's lacking in Liberia, Sierra Leone, Guinea, where there also aren't enough doctors to care for all these patients. And that, combined with the general mistrust and disbelief about Ebola, part of the reason why this outbreak has killed 900 people. And that's part of the reason, too, to bring these two Americans back home so they can get the kind of supportive care that will help their bodies fight the infection naturally.
We talk about that, and we hear that quite a bit, the mistrust. So the people don't trust the government and don't trust the authorities to tell them the right thing to do?
It's really stunning from Liberia that people are thinking the government workers are going to take their kidneys and sell them on the black market. There are people who say they just don't believe in Ebola, people who don't trust health workers, people who say that they can't tell Ebola from malaria from any of the other potential illnesses in Africa, and in the collective consciousness in Liberia, because of beliefs in witchcraft, there are secret societies and all sorts of variations of the boogeyman. So everything is kind of secretive and suspect, and Ebola has now spread to its worst outbreak. And of all the Ebola outbreaks since 1976, all the deaths, 36% of the deaths are caused by this one. So you get a sense of just how severe it is.
Why Emory Hospital? Why did they take the doctor and the Nancy Wright-Bowl to Emory?
Well, we don't know specifically. It's never been outlined for us, but I think there are a couple of reasons. One, the CDC is literally next door, and so infectious disease experts there can be involved in care and research. But also there's a practical matter in that it's the closest of 4 hospitals in the country with the kind of isolation unit that's required for an Ebola patient. The others are in Texas and Nebraska, Tennessee, and so this one, I think, being in Atlanta, is just the closest to Africa.
Aaron, there is no treatment, so how are they helping these patients in Emory? What are they doing for them?
They're focusing on their vital signs, their breathing, their blood pressure, they're monitoring their GI tract, anything they can do to keep the body as strong as possible. So blood transfusions, IVs, that kind of thing. Because you're right, McGraw, there's no cure. Now, both of these patients received a couple of doses of an experimental drug that made its way to Liberia from a company in San Diego that manufactures it jointly with a firm in Toronto. But it hadn't been tested in humans, and it was up to these patients to decide whether they wanted to take it. They did. They showed improvement, but even the company that makes this drug says, sometimes patients just spontaneously get better, so they don't know whether it's the drug or whether there's some other factor at work.
Yeah, so we don't know why some patients die and some patients are able to fight it off.
It's true. Now, in some cases, they die just because there aren't the facilities to even give them the basic supportive care that these two are getting. We just saw a ratio of doctors to population that was sent around from some aid organization. Very illuminating and disturbing. the fewer doctors per population, of course, the more stretched thin the healthcare system. Liberia, there is one doctor for every 86,000 people. So many Ebola patients will never have a chance.
These two doctors, do we have any idea how they got it? I mean, clearly it was by accident, but do we know how they came down with this?
They haven't said specifically what the point of contact was, but we've learned the suspicion is falling on a Liberian national who was working the cleanup crew at the missionary hospital where these two workers had been volunteering for the last year and a half or so. If that's the case, it's almost good news. The Liberian has since died, but because he wasn't a health worker, he was just on the cleanup staff, his exposure to others may have been limited. But it's believed he came into contact with Brantley and Wright Bowl. That's how they contracted the Ebola sometime prior to last Saturday. That's when the relief agency first found out about it.
When are we going to know when these two doctors are out of the woods?
Good question. And the short answer is I don't know. And I don't know that there's a specific protocol here. It appears that the acute symptoms are behind them. So now they're going to be watching for any reversals while also trying to maintain vital functions to make sure that the body stays strong and the infection fully goes away. Because once patients with Ebola who've survived no longer show symptoms and have been released to their families, their relatives have not gotten sick. So it's thought that you can get over this. But how long that's going to take, you can imagine they're going to be extra cautious here.
Have you heard anything about the Ohio woman and the two New York men who have displayed symptoms and are being tested?
Nothing officially that I've heard, but the suspicion is they do not have Ebola. But you get the sense that because certain symptoms may be similar, and because certain people may have traveled to certain places in West Africa, that there is a heightened awareness. And to some here at the CDC, that's a good thing. They want people to be far more aware. We saw a scare on an airplane coming into JFK in New York from, I think, Abu Dhabi, somewhere in the United Arab Emirates, where a child was vomiting blood, apparently, and so they instantly contained her, did some tests, turned out she was just dehydrated. But I think this has really caused some scare and concern about the further spread of Ebola. The World Health Organization is meeting an emergency session today in Geneva, trying to decide whether to declare a global public health emergency, which could further restrict travel into and out of the affected countries.
Aaron Katersky live in Atlanta. Great as always. Be safe. We'll talk to you down the road.
Thanks, McGraw.
Aaron Katersky live in Atlanta covering the Ebola situation in the, I don't know if I'd get into the ambulance that took the doctors from the hospital to from the airport to the hospital. I know it's safe, but I don't know if I'd want to do that.
Well, being the kind of funny germaphobe I am too, I'm not sure if I
don't know about that.
I may do a quick little peek in there, but
yeah,
not sure the purpose of.
All right, it's 6:30, Big 550, KT.